It's time now to talk about health care in the Valley. Do you know what to do as your loved ones age or become ill? Well, there are places to turn. Carolyn Richardson and Jody Malamas are here with more. Now, thank you both for coming in. This is such an important topic.
Absolutely. Thank you for having us.
Yeah, well, let's start with just the fact that there are different types of care that people out there should be aware of. First of all, there's palliative care. Is that right?
Yeah, palliative care. So a lot of times you hear the word palliative care in conjunction with hospice, but it can also be without hospice. The focus changes from cure and cause more to managing pain and symptoms and actually trying to alleviate emotional and physical stress on the body. Jody actually works with GAP, which is a PACE sponsor. She is a licensed medical social worker, and she can kind of come and talk. She educates patients and their families about the differences and the conjunction of palliative and hospice together.
So how would you explain this to a family?
Sure. So palliative in itself means it's a medical term to describe alleviating pain and symptoms, like Carolyn had mentioned. It's an approach to healthcare that doesn't really focus on curing an illness or a disease process. The difference between hospice and palliative is that hospice is for people who have a prognosis of 6 months or less, and that the person is no longer seeking any type of curative means, no surgeries, or maybe if they have cancer, no chemos or radiation. Palliative service, however, is more for people who have a longer prognosis, and they are still getting all kinds of different medical testing, treatments, surgeries, things like that. So that's kind of the difference between the two.
Now, when you go talk to people, how do they know? I'm sure they're asking you, like, do I qualify? Who does qualify for these services?
Sure. So when you are interested in either of those services, really the best thing to do is get an evaluation, because there is a medical evaluation for both. The hospice candidate is someone, again, who has a prognosis of 6 months or less, and they are no longer seeking any curative. And somebody seeking palliative could have a longer lifespan, maybe not a terminal illness, and they're still seeking other treatment. But the best way to know if you qualify is to get an evaluation.
Yeah, and what about as far as choosing a provider? How do we know if we have a choice in that, and also who pays for it?
That is so important, and I like to empower your viewers to know that you have a choice. In whatever provider you choose, you have the choice. If you are in the hospital, a lot of times a company's just sent in and you weren't given a choice. Know that you have a choice. Call a PACE care coordinator. We can help decipher which company would best fit your needs.
Yeah, that's important too, because PACE can help in this process.
Absolutely. We have a list of different providers through the Valley that may match up with your insurance. Doing an assessment to find out what your needs are.
Right, and you see it right there, how PACE can help today, because you have the guide, you can call on the phone, you can go online and get help, and you can actually meet with the coordinator in person.
Absolutely. A PACE care coordinator can actually come out to your home and sit and assess your needs.
All right, terrific. Thank you both so much for coming on and explaining this. It's difficult to talk about, but it's important information that you should know. And if you want to learn more, go to seniorhousing.org or call the number on your screen. And